Hey, y'all, welcome back to the Dental Hygiene Basics podcast. My name is Dana. I am your host. Excited to be here. And today we're talking a little bit about histology. Now, when you get into dental hygiene school, or if you're there already, or maybe you've already been through histology and embryology, I find that on social media, when people are talking about which classes are the hardest or that they're struggling the most with, I usually see histology and embryology, pharmacology, and oral path. I think farm and oral path, the reason why they are considered to be so hard is because there's so much memorization that has to occur. I think histology and embryology is super hard. One, because there's a lot of memorization, like you have to have a good foundation to grow into it and to fully understand it. But I also think it's because some of it feels almost conceptual, like it's like abstract in a way. It's really hard to visualize. How do we go from literally an egg and a sperm that fuse together to make a zygote into an entire human body? Honestly, it's remarkable when you think about it, which is one of my most favorite things and why I love teaching histology and embryology, because it just makes me feel like, wow, as humans, we are so special and resilient. I mean, life forms on planet in general are really complex, and the way that we develop is just, it's mind blowing, honestly. And I really hope that maybe after today, you feel a little excited to either A, start your histology and embryology class, or B, maybe this is a good refresher for you if you are getting ready to start the board exams. The thing about histology and embryology is it really is one of the baselines to build out your dental hygiene career. I'm thinking, part of me, I'm always thinking about like, if I had to teach dental hygiene school in a line, like what would be the first class I would start with, right? Like if I was just teaching one class at a time that would get someone all the way through dental hygiene school, what would I start with? And I really think that it would be histology and embryology. I think it's the closest thing to start you off on the path to understand all of your other subjects. Okay. Why is that? Because histology is the study of tissues. Now, why is that important? Because tissues make up our entire body, right? We have four different types of tissue. We have muscular tissue, we have connective tissue, nervous tissue, and epithelial tissue. Now, when you hear that, that may take you back to your anatomy days. And you'd be like, oh, yeah, that does sound a little bit familiar. But we want to take it back even a little step further than that, okay? The way I always like to start the conversation when it comes to histology is that you first have to really understand what a cell is, okay? And a cell is an independent structure and it's capable of individual life by itself, basically. I mean, our cells like to be linked up together, but they are capable of functioning independently as a unit. What does that mean? What that means is that a cell is basically like a tiny human, and our bodies are made up of tons of cells, which is like a bunch of tiny humans. When you look inside of a cell, or when you look at a cell, what do you see? You see an outer covering, right? That is the cell membrane, but really it's like the skin of the cell, right? It keeps the outside out and the inside in. When you look inside the cell, you see cytoplasm. Cytoplasm is like a watery goo that helps to suspend your organelles, right? So I think about it in context of the human body, right? If the cell membrane is like the skin of the cell, the cytoplasm is kind of like your connective tissue, right? It plays supportive roles and it helps to suspend the organelles, which are like the organs of the cell. Okay. So in, our human bodies, once they're all formed, we have tons of organs, right? And inside of a cell, there are little organelles and they act like little baby organs inside of the cell. So think about this. When you are super hungry or you're super thirsty, you are feeling that because your cells are hungry or thirsty. When you're tired, your cells are hungry and thirsty. Are you guys getting sick of me like telling you to take care of yourselves? Okay, go take a nap, get some water, eat well, right? Those are so important. I mean, I just realized through life, like if your cells are struggling, you are struggling. Okay. So we really want to get back to taking very good care of our cells and seeing how that can make our lives better. Okay. I always say, and I digress, right? I've gotten off topic, but I really haven't. So think about your cell as a ton of human little cells, right? So like I'm Dana, the human body, right? But my body is made up of little tiny Dana cells and they all need something. But what's really cool about cells is cells that are similar like to link up. And what they do is they link up and they form tissues. Okay, so you may be like, okay, I've got the cell down. I understand it's an individual unit. It's like a little tiny human operating on its own, but it likes to have a community, right? It likes to connect with tissues that are similar to it or cells that are similar to it, and it likes to form tissues. Okay, we talked about the four tissue types. We have the epithelial tissue. This is like your covering tissue. That's kind of what I think of, like your skin is epithelium. Why is this important? Because all of the lining of your mouth, so the inside of your lip, your labial mucosa, the inside of your cheek, your buccal mucosa, the hard palate, the tissue that you see up there, underneath the tongue itself, all of that is epithelium. Specific type of epithelium, it's stratified squamous epithelium. Okay. So that's important. We're starting to connect how a cell can link up with other cells to form tissues like epithelial tissues that we see when you look at a person, you see the skin. And when you look in the mouth, you see epithelium. Okay. From there, we have muscular tissue, right? We know we have muscles throughout our body. We have voluntary muscles, lifting weights, right? Get in the gym. It's good for you, good for your brain, good for your body, good for learning, good for a lot of things, good for sleep to exercise and move your body. Okay. We're making those cells stronger when we're exercising. All right. So from there, where do we see muscles in the mouth or in the head and neck? We have tons of muscles in our face and in our neck. And we have two main muscle groups. We have the muscles of mastication. Mastication means chewing. These are our chewing muscles. And guess where they attach? They attach to your jaw because your jaw is the only movable bone in your body, right? So if you want to move your jaw, you have to move one of your muscles of mastication. From there, we have muscles of facial expression. So if you're winking, blinking, smiling, frowning, pouting, I just did a full gamut of facial expressions on the YouTube video. Those are your muscles of facial expressions. Okay. We also have muscles in our tongue that help our tongue to move. We also have muscles up connecting to our palate that helps, our palate to move a little bit as well. We have muscles in our throat that help move food down our throat and help us to swallow. So that's muscular tissue. Okay. We also have little muscles in the blood vessels. This is going to be important because you're going to learn about medications in dental hygiene school that open the blood vessels. Vasodilation. Vaso means vessel. Dilate means to widen. So there's muscles inside of your blood vessels that widen those blood vessels. There's also muscles that will constrict or make those blood vessels tighter. That's vasoconstriction. Okay. That's going to be important because there's drugs that widen and there's drugs that constrict. Okay. So we're starting to kind of see a baseline. How do I understand that the cells link up to make tissues and how do the tissues apply to what I'm going to learn in dental hygiene school? Okay, next thing on the list, the next tissue, connective tissue. When I think of connective tissue, I think it connects the body. Okay, so the way I think about this, like your bone is connective tissue. Your blood, your blood runs through your whole body. So to me, that's connecting. Cartilage is connective tissue. Okay, ligaments, tendons, those are connective tissue. They play a role in connecting. So that's kind of the way that I categorize it in my mind. Fat is also a connective tissue as well. So we think about where do we have connective tissue in the mouth? So think about that word connecting. Think about your teeth. Your teeth are sitting in bone, but they're not fused to the bone. There's actually a ligament that goes all the way around the roots of your teeth and it suspends the tooth in the bone. Okay, so that's really interesting. We have connective tissue, the periodontal ligament that suspends the tooth in the bone. We know we have blood in the mouth as well, right? So we see that connective tissue there. But underlying the epithelium. So remember, when you're looking inside your cheeks, when you're looking at the labial mucosa, you're seeing epithelium. But below that, there is connective tissue, and it's known as the lamina propria. I think I'm saying that right. Lamina propria. That's the underlying connective tissue that sits below the epithelium. And that's really important because the epithelial layers actually do not have vascularity. There's no blood flow, but those cells need blood. So what do? The epithelial cells and the underlying connective tissue fit together like two hands holding. They interdigitate, okay? And the connective tissue is going to connect in and interdigitate with the epithelium, and it's going to supply vascularity because the connective tissue has blood vessels in it, which makes sense because blood is a connective tissue. Okay. So, really kind of interesting. We're starting to see the puzzle pieces coming together. The last component, the last tissue is the nervous tissue. And the nervous tissue, when I think of nervous tissue, the first thing I think of is the nervous system, the brain, the spinal cord, right? But branching off of that brain and that spinal cord, there are a ton of nerves, and there's 12 big ones that you need to know. Those are the cranial nerves. And off of those cranial nerves, they go to your eyes, they go to your nose, so you have sense of sight, sense of smell, sense of hearing. This is going to be, all of your sensations, right? If you slap yourself in the face, like that's a sensation. You're getting that from a cranial nerve. If you bite your tongue, that's a sensation. If you taste something on your tongue, that's a sensation, right? So we get all that from the cranial nerves. Cranial nerves also provide movement. So earlier we talked about those muscles that connect to the jaw. And in order to move the jaw, right, something has to trigger that to happen. That's where your nervous system comes in. So your cranial nerves, which you're going to learn all about in head and neck anatomy, those are actually involved in the nervous system, right? And they are playing a role in innervating nerves, innervating structures in the body so that we get sensation or motor movement to one of them. Okay. We also have nerves in our periodontal ligament. We talked about the ligament is the connective tissue that holds the tooth in the socket. There's nerves there. So think about if you bite down really hard, like let's say you accidentally bite on a rock or a popcorn kernel, something super hard. What does your mouth instantly do? It recognizes it and your mouth slightly opens up. Why? Because you're like, I don't want to bite down too hard on that. You're getting sensation from your periodontal ligament saying, be careful, right? So you're getting that innervation from those nerves, which is just really, really cool, how our body works together. So I think it's really important, even before you get into head and neck anatomy, to start at the baseline, right? Do I know what cells are? Okay, check. We've got that. Cells link up to make the four main tissues. And then I want you to connect that. Why is that important for what I'm going to learn? Where are these tissues found in the mouth? Okay, we've got that solidified. Now you have to think about tissues connect to make organs. Okay. So we have tons of different organs in our body. You have your thyroid, that's an organ. Your heart, that's an organ. Your bladder, that's an organ. And through these different organs, they connect together to make organ systems. Okay. So for example, we have our reproductive system. Okay. That would be like in a female, uterus, ovaries, right? In a male, that would be like the testes, the penis, right? Those structures. Okay. Then we have the urinary system. Okay. That would be like your kidneys, your ureters, your bladder, right? So these systems, these organs that are formed by tissues, which are formed by cells, make up the organ systems. And that's what makes up your whole body. Okay. When I was teaching histology and embryology in dental hygiene school, I would always take this opportunity to sing, "It's the circle of life." And the reason why is because you have to think of it as the full progression. Cells make up tissues, tissues make up organs make up organ systems make up the body. Okay. So now you've seen the full progression and how it plays in and shows up in the oral cavity. Okay. And, your oral cavity, I guess I should mention, is a part of your digestive system, your gastrointestinal system. So it connects your mouth down to your stomach, down to your intestines, colon, and out the back end. Okay. So I'm hoping that you see the full picture and how these connect. I know that it may seem a little abstract. You're thinking about it in your mind. This is the baseline. So if I was getting ready to go into my first histology class, this is what I would listen to. If I was getting ready for the national board exam and I'm about to start studying histology and embryology, this is what I would listen to build that foundation. Now think about it from here. I just told you that every tissue in the body is made out of cells. I just told you all the tissues in the body, the bones, the ligaments, the fat, the muscle, blood vessels, all of that are tissues that is being built. And when you get into head and neck anatomy, now you're going to have the baseline for it. How are those structures built? What are those structures? Now we can actually step into it and start to see it on almost like think of it from like the beginning of time. Like think about histology and embryology, like from the beginning of time, this is how we formed into the bodies that we are. And that's what makes us so fascinating. And that's what makes learning fun. And I really hope that I got that across to you guys today. So if you have any questions about histology and embryology, I am here for you guys. It's one of my favorite subjects, always putting out study videos about it. And yeah, just let me know, reach out to me. If you're not already following me on YouTube, head over there too, because I'm posting videos on there as well. You may go through old videos like in my histology and embryology folder if you're going through that at the time. But like I said, always here for you guys. I know that you're going to crush it. Best of luck on your journey. Future registered dental hygienist, have an amazing day.